using drugs, developing a mental health condition, or having a mental health condition and using drugs. And it's not always this simplistic. So just to prepare you, it can be a much more complicated and complex relationship between the two. And it's important to note as well that it can be really dynamic and fast changing as well. So it can change quite a lot about what the relationship between the two is as well. But just to give you an idea of how the two can interact. So I'm going to share some examples now, just to give you an example of 4 commonly used drugs in the student population and their effects on student mental health as well. So the first I'm going to cover is alcohol. So obviously I'm aware that alcohol is legal, but it is actually the most toxic of the more commonly used drugs that students will use. In moderate use, it's not really usually a problem. However, long-term effects are associated with some significant mental health concerns, and especially when it's used over a long amount of time. So as you can see on the slide there, some of the short-term effects of using alcohol will be things like feeling relaxed and more social. You might feel a bit subdued, or it could lead to uninhibited behaviours or aggression. However, there are quite a few mental health links to longer-term use of alcohol. Things like memory loss, difficulty thinking clearly, difficulty problem solving, poor concentration and addiction as well. And again, when it comes to dependency or withdrawal, we see that anxiety and delirium are 2 key factors there that are associated with dependency of alcohol and withdrawal of alcohol as well. So we can see there's some really clear links between the use of alcohol and the longer term use of alcohol and mental health. Cannabis is the second example I'm going to use here. So people take cannabis as a way of feeling relaxed and getting high. And actually the effects that someone experiences when using cannabis will really depend on, the type of drug that you're taking, how much you take, the type that you use, and also your genes actually. And also if you're already experiencing some mental health concerns such as anxiety and depression, you're much more likely to experience the negative effects of cannabis as well. And interestingly, well, actually, it's interesting to me, I don't know if it is to other people, whether or not you get the psychotic effects of cannabis actually depends on your genes. So there's a specific gene within the body that codes for a brain enzyme. And there's 2 versions of this gene. And one of those versions means that you're much more likely, you've got a much greater chance of actually experiencing the psychotic effects of cannabis, much more likely than the other. So that's just important to consider when we're thinking about who might experience these negative side effects. So the shorter term effects of using cannabis include things like feeling relaxed, talkative, finding things funny or hungry. But then we start to see some quite worrying mental health concerns when we look at people who might use cannabis in higher doses, as we start to see things like distorted perceptions, forgetfulness, distress and confusion, and also some psychotic experiences such as hallucinations. And again, when looking at the longer term effects, we do really start to see some very concerning mental health related issues and concerns here, including longer lasting symptoms of psychosis that could be diagnosed as schizophrenia, and potentially also depression in later life, particularly if cannabis has been used a lot when younger. Okay. The next drug I cover is ketamine. So ketamine is an anaesthetic and it's mainly used in animals. So it's quite similar to PCP, which is another anaesthetic that can be used to stop people feeling pain. And it does also cause hallucinations. So ketamine does have antidepressant effects, and it's actually being used at the moment for research to treat treatment-resistant depression and also PTSD as well. So as I mentioned, ketamine is a hallucinogen with short-term effects, including things like poor concentration, challenged perception of surroundings, feeling out of touch with reality, delusions, paranoia, nightmares. But more seriously, a bad trip might make you actually quite violent, suicidal, or likely to harm yourself. So we can see that even with the short-term effects of using ketamine, that there is some quite significant mental health concerns that we need to be aware of. Again, with the longer term effects, this tends to worsen, particularly around mental health. So it might lead to depression, panic attacks, anxiety, or difficulty thinking clearly. And again, looking at the dependency and withdrawal symptoms, these include depression as well. And the final example I'm just going to give to you is around ecstasy. So for example, MDMA. So we do know that ecstasy tablets are notoriously impure and do often contain substances other than MDMA, for example. So this is just something to consider when we're talking about the effects of taking this type of drug. And although ecstasy is a stimulant, it actually has different effects to other stimulants, such as amphetamines. So for example, it might cause feelings of empathy rather than feelings of euphoria. And it's actually widely recognised that it's very, very dangerous to take ecstasy alongside other types of antidepressants as well. So I'll talk in a little while about the dangers of mixing sort of psychiatric medication and substances as well. So with the short-term effects of ecstasy, we can see there that some of the effects may be feeling happy and relaxed. And again, as I mentioned, the feelings of empathy, openness and caring. But again, loads of mental health concerns when we look at longer term use of this, including depression, loss of confidence, anxiety, confusion, agitation, panic attacks, and also hallucinations and paranoia after repeated high doses as well. So again, some really concerning mental health interactions between those drug use and what a student might experience. So I'm just going to talk to you a little bit now about dual diagnosis. So if a student has a mental health problem and also has problems with drugs and alcohol, they're likely to be described as having a dual diagnosis. And this might actually cause a large number of problems because it could start to impact many different aspects of your life. So like I spoke about before, it can start to impact things like finances, social life, housing and things like that. And there's actually no standardized treatment for dual diagnosis, so it really depends on the situation as to how this would be treated. But I'm going to talk to you a little bit now about what typically would happen if someone was diagnosed with dual diagnosis, so if they're presenting issues with mental health concerns and also drug and alcohol concerns, and what this typically would look like. But before I do that, I just wanted to share a couple of things that you should consider if you do find that you're having to support students that may have dual diagnosis. So both issues with their mental health and also with substance misuse as well. So one of the key things really, as I mentioned earlier, is the use of substances, so illegal drugs, for example, plus the use of psychiatric medication, which is a common issue with students that might be experiencing dual diagnosis. So it's widely known that when you take two or more drugs at the same time, they will interact with each other and it could affect how the other one works. So for example, it could be that one or both of the drugs become toxic. It could be that their effects are decreased or their effects are increased. And this will depend on a lot of different things, such as your age, your weight, your genes, your liver and kidney function and things like that. But there are some really quite well-known interactions between commonly used psychiatric medication and substances as well, that I'm just going to use as a couple of examples here. So for example, taking MAOI antidepressants with any other type of illegal substance can actually cause really dangerous effects. So this can include high blood pressure, chest pain, rigid muscles, flushing, vomiting, and severe headaches. Chlorpromazine, which is an antipsychotic, when mixed with amphetamine, could actually lead to the effects of both drugs being reduced, which could lead to more of the drug being taken. And another example is if you were to take lithium, which is a mood stabilizer, with either alcohol or ecstasy, it could actually cause a lot of dehydration in the body, which could actually cause the lithium to become toxic in your body. So there are just a couple of examples of ways that your substance misuse can actually interact with psychiatric medication to either decrease or increase the effect of those drugs, how that could impact future use, and to also consider when it could actually be dangerous for health as well. The second thing I've put on the slide to consider is around prior mental health concerns or diagnosis. So it could be really important to consider if the student has had any prior mental health diagnoses, because this could impact the type of support that's appropriate to the situation, for example. And it could also be worth asking if there's any family history of mental health disorders around problems with alcohol and drugs as well, because this could also help to identify the type of support that might be most appropriate. With underlying issues, so as I've alluded to a couple of times, there could be many underlying issues that are contributing to one or the other. So there could be underlying issues that contribute towards someone having depleted mental health, or it could be something that contributes to someone and their substance misuse issues. So for example, as I mentioned before, this could be things like financial concerns, housing issues. They could be struggling with their academic study. They could be having a tough time getting on with their flatmates or having some issues socially. So it's really important to try and identify what the underlying issues could be, because those could be things that could be easier to tackle, which will just contribute towards a kind of a whole picture when supporting a student. And then I've put a little picture of a chicken and egg there, because again, which came first? So it can be really, really helpful to understand which element of the dual diagnosis came first. So for example, did the student show some mental health concerns which could have triggered substance misuse, or could it be that substance misuse potentially has triggered the development of mental health concerns? And again, it can just really help to identify the source of some of these issues and get a better understanding of the type of the student's personal circumstances, and it can inform the type of support that would be most appropriate for that student as well. So there are some questions that you can ask students to kind of tease this information out of them. You know, it doesn't have to be as direct as kind of how I've described it on the slide. So it could be that we ask a student, you know, do you use alcohol and drugs to cope with unpleasant memories or feelings, or to control pain? Have you noticed a relationship between your substance use and your mental health? So for example, do you get depressed when you drink? Do you feel depressed or anxious even when you've not used substances or when you're sober? Have you ever previously been treated for addiction or a mental health problem? You know, so these are some of the questions that we can be asking students just to try and tease some of this information out. Okay, so now I'm just going to talk a little bit around the typical support that might be available for someone who might be experiencing issues with substance misuse and mental health at the same time. And then I'm going to look at another couple of different types of support aside from professional that it might be beneficial for universities to consider as well. So like I mentioned, I'm going to start with professional support and focus on this just at the moment. I'm just going to take a quick sip. Okay. So many local NHS trusts will actually have a policy about how they treat dual diagnosis locally. So as a university, it's actually quite helpful to have a look at the local NHS trust websites to see sort of what you can expect locally for students. If your student isn't having treatment from a local mental health team already, a good first step is for actually to encourage them to speak to a GP. So it might be that a GP might offer them medication and therapy to treat the mental illness side of things, and they will likely refer the student to an external drug and alcohol service to tackle that side of the issue as well. We might see that if the issues are quite complex, so I spoke earlier about how this relationship can be really quite complex and complicated. If it is that it's too complicated for the GP to support with, the student might actually be referred to a local mental health team or community mental health team, for example. And this team will support alongside the drug and alcohol service to ensure the student gets as much support as possible for both elements of the diagnosis. Okay. The National Institute for Health and Care Excellence actually has produced some guidance for the NHS around dual diagnosis specifically. And they have said that if people do have sort of severe mental illness as well as drug or alcohol problems, then they should get help under the care programme approach. So I've just put up a bullet point on this slide about the CPA. So this is essentially a framework that the NHS might use to plan someone's sort of longer term care. So there'll be sort of a designated support worker who can help develop a care plan for the student, incorporate the different things as well. So other types of support like the financial, like the housing, physical health and things like that, that could also be impacting the situation. And I've just popped on as well at the bottom of the slide there, alongside the NHS and their services, it could also be worth linking up with several local charities or organisations to the university as well. So many charities will actually have support services or support groups for people who are struggling with dual diagnosis or substance misuse. And I've just popped some examples on the slide there. So We Are With You, Release and Alcoholics Anonymous. At the end of the presentation, I do have a list of helpful sort of contacts and organisations, and these are all included in there and hyperlinked through to the website. So once you get the slides, you'll be able to have a look at these yourselves. I also wanted to share how a friend or family member could also support someone who might be struggling with dual diagnosis. So when we asked students at Keele if they were experiencing a mental health concern, for example, who would they be most likely to disclose it to? The majority of students responded that they would always go to friends or family, and far fewer actually said that they would reach out to a support service, whether that's at the university or whether that's externally to the university. So this has got us thinking about how we can get information out there to friends and family that might be supporting someone with these types of issues. So this week alone, I've had a student email me say they've been concerned about their boyfriend whose substance misuse has got a bit out of control and it's affecting the mental health of the boyfriend, but also the student that got in contact with me. So we do know that there are students that are struggling with this, disclosing this to friends and family, but are not reaching out for professional support. So I just wanted to mention here about the types of things that we can put out onto our web pages or into our policies that can mean that we can support those who might be supporting students with dual diagnosis. Okay, so it is again widely recognised that supporting someone who is struggling with dual diagnosis can actually be really, really difficult. And the types of things that a student who's struggling might need could vary quite a lot. So for example, someone who's struggling might just need someone to talk to, or they might want some practical help for booking appointments, or they might want someone to suggest some support services that are available to them. So it really does depend on the situation as to what the friend or family member or whoever it might be can offer that student who's struggling. But there are a couple of charities and organisations who will offer support and advice to friends and family. So if you are concerned about someone else and want to speak to someone about it, for example, We Are With You and AdFam will talk to you about that and will offer some advice. So there's some really useful signposting tools that we can use to support those who might be supporting students with dual diagnosis. It could also be really valuable as well to provide sort of advice and information to the supporters of the student, as this could also be a really good way of getting messages through to the student who is struggling with their substance misuse or mental health as well. So I've just popped a couple of tips on the slide there, just some things that friends and family can do to support the student. So for example, accept what you can and cannot do. So a family member or a friend isn't going to be able to force someone to stop taking them, to change their substance misuse behaviours. You can't stop someone taking drugs, you can't make someone take medication or keep appointments, but what you can actually do is just make positive choices for themselves. Encourage the person who's struggling to get help, but also make sure that the supporter doesn't lose themselves in the process as well. It can also be helpful for the person who's supporting to seek support for themselves as well. So as I mentioned, it can be quite painful, it can be really difficult and isolating, trying to support someone who's got drug use issues or mental health issues if you're not trained to do that yourself. So it's really important that the person who's supporting that student also gets support for themselves as well. A good tip is also to set boundaries, so be realistic about the type of support they can offer and how much as well. Educate themselves around what could be what type of mental health concerns the friend or the family member could be experiencing. Understand kind of the treatment and recovery processes as well linked to those concerns, and that'll mean that they're better equipped to kind of support that student. And also we just encourage people to be patient as well. There isn't no overnight fix for this type of issue. Relapse is quite common, so it's just really, really important for the supporting person to be quite patient as well. But really the underlying message is that we don't want anyone to be suffering themselves because they're trying to support someone on their own. We would always encourage people to reach out and ask for professional support for themselves, even if the person has a substance misuse issues or mental health concerns, doesn't want to come forward themselves. It could be that the person that's supporting them, the friend or the family member, might actually want to get support instead. And then another layer of support that I just wanted to talk about as well was around self-care. So self-care is quite an important aspect of support, and I think it can work quite a lot to complement any professional treatment that's being received, but it can also mean that students might feel more empowered to address the problems that they're experiencing. It could mean that it prevents any issues from getting worse and reaching crisis point as well. So it's really, really helpful to try and think about what types of things a student can do to look after themselves if they are experiencing these types of issues. And again, this is something that universities can share on their web pages or in their policies or whatever it might be, to support those students that might not feel comfortable coming forward, or it might not be at a point where it's starting to impact all the other areas of their life as well. And it's also important to remember as well that if someone is recovering from something like dual diagnosis, if they stop taking the substances, for example, that's only the start of the journey. Everything that they do needs to be sustained, and in learning some of these self-care tips can really help to sustain that as well as time goes on. So like I said, providing this advice to students can actually be really, really helpful for supporting with dual diagnosis. So there's some tips on the slide here of things that you can suggest to students. So things like learning to manage stress. So we find that students often use drugs and alcohol as sort of a misguided attempt to manage stress. Stress is an inevitable part of life. It's something that we all experience. So it's about teaching or learning healthier mechanisms for coping with stress. And also coping with unpleasant feelings. So again, this could be something that students turn to alcohol and drugs to cope with feelings of, anxiety or stress or loneliness or depression. So there's, again, it's about just teaching ways that people can handle those in safer and healthier ways as well. Another tip is for students to know what their triggers are and actually have an action plan. So if they feel like a trigger is approaching or they have been triggered, have an action plan to know how they would adapt to that situation. So if they know, for example, that big life changes is something that will trigger them, it's about having a plan in place to understand how they can recognise that that might be the case and what they would do instead of considering prior unhealthy behaviours. The second tip is around connecting. And again, this is a really difficult one at the moment because we're all sort of physically isolating from each other. So it can be really difficult to connect with others in meaningful ways. But we do know that positive emotional connection is one of the quickest ways to actually calm our nervous system. So it's really, really important that if a student is struggling with drug or substance misuse issues, or they are having mental health concerns, that they have a good support network around them and that they have people that they can connect with, whether this is on a video call or whether this is going for a walk with someone, and having that regular contact is really, really important. A student might get to the stage in their recovery plan as well where they might feel like, oh, I don't need this medication or this treatment anymore. I'm doing really well. The symptoms aren't really there anymore, so I'm going to stop taking this or stop attending. This is a really common way that relapses happen, so it's really important that we encourage students to always follow advice from healthcare professionals. And actually getting involved in groups or therapy can actually mean that someone's chances of staying on the right path, staying sober, or doing well with their mental well-being is actually going to improve. So it's really important that we offer those types of advice as well. Making healthy lifestyle changes, this is something that will improve any type of well-being. So particularly looking at things like exercise is one of the great ways of busting stress. Learning relaxation techniques, so yoga, meditation, things like that can really help to improve mindfulness. Healthy eating habits, so things like your blood sugar can really impact your mental health, and it's really important that you're eating the right types of food to boost your mood. And again, getting healthy sleep, if we've all felt it, if we've not had enough sleep that night, we might feel a bit more stressed or anxious than usual. So making sure that someone gets enough sleep is really important as well. And then the final one is around finding new meaning in life, which sounds a bit cheesy, but on the front of it, it's really about understanding how someone can remove drugs or alcohol or whatever it might be out of their life for the long term. So it's about the sustainability of these new behaviours. And it's really important to build on this because when those things are removed from your life, you'll need to replace them with something else. So it might be that someone might want to develop some new activities or interests, volunteer or meet a new group of friends or whatever it might be. It'll just give their life a little bit more purpose and meaning, and mean that, if they are triggered again or they feel that a relapse is approaching, they've got other things to replace where they previously would have turned to drugs or alcohol, for example. And again, learning what the triggers are and avoiding those as well is really important. So that could mean actually making some quite significant changes to your life as well. So it can be really difficult for a student to do this but just offering support in ways that they can do this, meeting new people or changing the places that they used to hang out or whatever it might be. It could just be really good ways that students can try to avoid that relapse as well. So what can universities do? So I've spoken a little bit around support, the types of support that can be offered and shared with students or friends and family. And I'm now just going to talk you through a little bit around what universities can do, particularly around sort of 3 key areas. So education and early intervention. We're going to look at policy, and then we're also going to look at research as well. So education and early intervention. This is somewhere I really see students' unions getting involved in this piece of work and working with the university on this. Because one of the key things that I've written about is campaigns. So many universities will already run alcohol awareness campaigns or mental health campaigns, but it's a little less common for the links to be drawn between the two. There's a really nice example actually on the slide of a previous campaign that's been run around Are You OK, and looking at the links between alcohol and mental health and what support's available. So there are loads of great resources out there, and again I'll have a slide at the end with some helpful resources on it if anyone is considering running a campaign that will draw the links between the two, or whether it could be that a commitment is made so that in the next Alcohol Awareness Week we draw links to mental health and vice versa for Uni Mental Health Day, for example, or Mental Health Week and things like that. A second tip would be to enable information sharing among stakeholders to enable early intervention. So what I mean by this, there's multiple things, to be fair, that could be said by this. So for example, internally, it could be that an academic member of staff has been made aware of a student's substance misuse issues or their mental health issues. And it's about making sure that there's clear processes and pathways for academic staff to share that with support staff, professional staff, and vice versa as well, so that we can enable timely and effective early intervention, but also make sure that we're getting the full picture as well about students. So it's really important that staff are trained to recognise what signs and symptoms they can look out for, but also know exactly who is available to refer those students through to as well. And when we talk about information sharing as well, it's also really beneficial to have strong working relationships with external stakeholders as well, as this can help to again enable that effective and efficient referral through to the appropriate services and effective discharge protocols and things like that, to make sure that the student journey is as smooth as possible. Training for staff I just touched on, but there are many external training sessions that are available for university stakeholders around alcohol and substance misuse, but also mental health and the links between them. And ensuring staff have sort of a basic understanding of the types of things to look out for and be aware of if a student might be struggling is really, really important, and making sure that all staff have got the knowledge of what support is available for that student and who they can refer to if they feel like a student is struggling is really, really important. And again, it'll just help to ensure that whole institution approach to tackling some of these issues. And this isn't, you know, a tip that's kind of specific to this topic. This is something that will be relevant for any type of wellbeing of students as well. But also I've popped in there about training for students as well. I think it's particularly important because we want our students to feel empowered to make the best decisions that they can for themselves as well. So it could be that we offer information to students about the harms of substance misuse, a harm reduction approach, and the links to mental health as well, just to make sure that students are making the most educated decisions for themselves. And then I've popped a note at the bottom there as well around student co-creation, because it's really, really important that when you're developing, for example, campaign materials or intervention materials for any area of wellbeing, if you can ensure that the materials have been co-produced with student, it just means that they're going to be much more accessible, much more engaging for students themselves. So it means that the message might be taken on board that little bit more. And Student Minds have done some really great work into student co-production, have created a great guide on how we can ensure that students, how we can ensure student co-production when developing things like mental health campaigns. So it's worth checking that out as well. The second thing that a university can do in this area to support students is have a good policy. So we've heard many times throughout this conference about the benefits of a harm reduction approach, and this is something I am also going to champion. It's really, really important that, you know, we implement an environment that is supportive for students, that isn't punitive, And just to make sure that we're creating an environment where students feel comfortable that they can come forward to discuss any issues that they might be experiencing without fear of being punished for it. Okay, so obviously we recognise in a lot of situations that maybe that a discipline approach is necessary, but the important thing is that the student will be supported through that process as well. Okay. So what I've done is I popped an example of Keele's student misuse approach on the slide there, and the next bullet point links to the stakeholders that are involved in this piece of work. And as you can see from our approach, our Students' Union and the university and our postgraduate student union will all work together to create this joint approach to substance misuse. Okay, so it's really, really important that student unions are involved in the development of these policies as well, because it just means that there's going to be consistency in language and approach, but it also means that, you know, it contributes towards that whole institution approach again. Okay. And again, similarly as well to linking in with the Students' Union, we would also recommend that you link in with any other university strategies. So for example, we have a health and wellbeing strategy at Keele, and within the section where we talk about supporting students with mental health, we also talk about the work that we'll be doing through drug impact as well. So it's really important that the links are made in these sort of top level policies and strategies as well as kind of the practical and operational things that you will do. I've spoken a little bit already about having clear support pathways and making sure that they are as effective as possible for students. So this can be done through having links with internal and external services, particularly through your counselling and mental health teams. I know at Keele, for example, we don't have a designated substance misuse worker at the university, so it's really, really important for us to have really close links with sort of external services, and that these are really well known to our counselling and mental health team. So that both sides of the treatment, as we discussed earlier, are met. It's just an important note to consider here as well. There's often some questions around who can refer into these services. So whether it has to be a mental health practitioner, for example, whether the student can self-refer, whether a friend can refer. So it's always good to kind of iron out these details as well when linking up with external services. And something that more recently has been considered at Keele as well is the level of support that's required for university settings and how this fits into the external support services as well. So for example, our local adult substance misuse organisation have really quite high thresholds for what would meet the needs for someone to visit that service. So for example, when we see students that are struggling with cannabis use or party drugs, this typically wouldn't meet this threshold that would be needed for a student to be referred into an adult service. So what we find is we've got a bit of a gap there of students that might have sort of lower level drug issues and have a gap there in terms of the support that we can offer them, because we can't refer them externally to that service. So what we're looking at the moment is how we can use self-care to support those students that might have that lower level drug use, but we're also looking at peer support as well and how peer support can be used to support that gap as well. And then the final thing that universities can do is around research. So it's really important to consider conducting your own research at your organisation so that you can gather sort of relevant and contextual information about substance misuse and mental health concerns of students at your organisations. But there's also some really, really great national data sets and reports that are being released as well. So Neurosite, Taking the Hit and Release and things like that have all produced reports. So this will help to have an understanding of what's happening across the sector. It means you can compare what's happening at your university, but also data collection will also just help you to benchmark so you can see the impact of the work that you've been doing and how you can understand the impact that has had as well. And then once you have this data as well, you can use the analysis to really inform a lot of the work that you do. So for example, you can identify which groups of students may be vulnerable to mental ill health, or the reasons why students are using substances, particularly in relation to mental health, if they're using it to cope or to self-medicate, or if we know that someone is struggling with their mental health, are they, is drug use included in that as well? And that will just help to target some interventions there as well. So I've just got 2 more slides left, and these are some helpful resources and some helpful contacts, and then I'm happy to take any questions. I'm just going to check the time. Perfect. So on this slide, you'll all receive a copy of these slides, so you'll be able to click through to the various resources that I've tagged here, but there's loads of great resources out there. This is just a snapshot really of what I've presented. So some really great harm reduction advice on drugs and me. There's some general information on loads of different websites, including Mental Health Foundation, Rethink Mental Illness, Mind, DrugWise. And then, as I mentioned as well, if we do find that there are friends and family that are looking for support, We Are With You is a particularly good example of ways that those people can get support there as well. And I know this is really text heavy and really small font, so I'm not going to go through these, but just to share with you some relevant sort of organisations and charities that might be helpful to kind of be aware of if you're supporting students that might have substance misuse issues, mental health issues, or dual diagnosis as well. So that's everything from me. I've put my email address on this slide, so if you do have any further questions after the talk, please do feel free to get in touch. I'm going to stop sharing my screen, and I can see that we have had a question come through, so I'll have a quick look at this. Just noticed on the previous slide about Samaritans and an option to ask for Joe. Could you explain, please? Yes, so with Samaritans, they have just the generic Joe email address. Will basically put you through to anyone that works at Samaritans. So it's not a specific person. It's just, if you were to email Samaritans, you would email Joe at Samaritans, and it'll pop you through to anyone that is working there at that point. Okay. That's the only question I've got. If anyone does think of anything, feel free to pop them in the chat box. I know we've got a couple more minutes left. But if not, we can all have a nice early finish.
Everyone always likes an early finish.
Absolutely.
Amazing, but let's hang on a second. That was such a interesting presentation. It was really nice to have both the mix of the explanations on how kind of the different drugs interact with kind of mental health medication and the links there, but then also the kind of practical tips on what we can do to improve our services. So thank you so much for delivering an excellent session. Amazing. You've also got the graveyard shift. I feel like people ask less questions later on in the day.
No problem.
Amazing. Well, thank you so much for joining us, Cara. And everyone else, we'll see you back tomorrow at 1 p.m. again. So I'll do the same as I did today and send you out the agenda so you can check what time all of the sessions are and plan which ones you're going to attend in person. But thank you all for attending today, and I hope you enjoy the rest of your afternoon/evening. It's nearly the evening. If you're meant to finish at 5 o'clock, I give you permission. I don't have permission, but I think it'd be fair to have a little early finish and enjoy 10 minutes extra sunshine if it's sunny where you are.
Absolutely. Thanks very much.
Thank you so much. Bye.
Bye.